Okay, Mr. Chair, we are recording and live streaming. I will confirm with you that you do have quorum. Warden Hicks is not attending today. And right now we don't have Councillor Robinson. All other members are in attendance.
All right, thank you, Heather. Good morning, everyone. We'll call this Long-Term Care Committee of Management meeting to order for May 10th. It is 9:30. Welcome, everyone. Just to remind members of the committee of their obligation to declare a declaration of pecuniary interest or interest. Seeing nothing, if anything should arise, you may declare it at that time. We have first report is the LTCCR CM 07 2022 regarding the long-term care operational report dated February 15th, 2022 to April 14th, 2022. And that it be received for information. Can I have a mover to get it on the floor, please? Moved by Member Burley and seconded by Member Klumpus. I believe we're turning it over to Dana first. So the floor is yours, Dana.
Good morning, and through you, Mr. Chair. You'll see in the package the Canadian Institute for Health Information 2023 Q3 data for publicly reported indicators. As we've shared previously, the data continues to show an increase in acuity with residents requiring greater levels of care. In addition to using this data to inform our team's operational and quality improvement plans, the indicators are reviewed and assessed quarterly with the medical directors of our 3 care communities. The Long-Term Care Home Act does require that each home have a medical director who must also be a physician. And to provide you a bit of their overview, they fulfill crucial functions, not only in providing our residents medical care, but also administrative functions as they advise us on a multitude of medical and clinical policies and procedures, along with informing our clinical programs. They also act as supervisors to attending physicians who also attend the home and ensure around-the-clock medical coverage for residents. In Grey County, we are very fortunate to have long-standing support and medical leadership from Dr. Brian Power, who supports Grey Gables, Dr. Cornelius Van Ziel with Lee Manor, and new to Grey County, Dr. Mary Pillish, who signed on as Rockwood's medical director in May 2021. So she's been with us for a year. You'll find their respective annual reports in your package, but I want to just bring to your attention some of the highlights they shared. They commended the home's rapid implementation of the Ministry of Long-Term Care and Public Health directives and guidance documents. They also highlighted our infection prevention and control measures to mitigate risks and found that really supportive as we provided care. Also our high rates of resident and staff vaccination, and in many cases we were definitely ahead of the curve, so appreciate the staff and resident and families. They also highlighted the team's ability to manage complex medical care and acute care needs within the home, which is really significant in the year as we all faced healthcare pressures. And highlighting new for 2021 was a complex care model that we implemented in one of our Grey County homes, a diabetic review program, and the new behavioral support transition unit, all of which had significant support and leadership from the medical directors. So in the coming year, and you'll see more of it, but the medical directors' roles are being reviewed with the Fixing Long-Term Care Home Act. I think we're in great shape, but we'll also see in the coming year a variety of opportunities for quality improvement, such as improving the medical director's remote access and use of our home's electronic medical records. So being able to see resident profiles from remote locations, as well as enhancing palliative care for our residents, where all of those are going to be implemented with our medical directors in the coming year.
All right, thanks, Dana. That's certainly positive information. I think committee members, we're going to go through the entire operational update on the 3 homes, and then if there's questions for Dana or any of the executive directors, we'll take them at the end. So I'll now turn it over to Stacy.
Thank you. Good morning, everyone. Through you, Mr. Chair, I'll provide the report from the ministry. So across the 3 care communities, there was 1 visit from the ministry, which was made to Lee Manor. And the inspector arrived on March 15th, exited on March 18th. The purpose of their visit was to conduct a complaint inspection, as well as follow up to 2 critical incidents that were reported earlier in the year. And while they were here, they also completed a review of our IPAC practices. During the course of their inspection, it's very thorough. The inspector spoke with staff, spoke with residents. They observed residents in the care that was being provided. They reviewed care plans, relevant policies and procedures, as well as our reports. And at the end of it all, there were no areas of non-compliance issued, and the other care communities didn't have any visits during this reporting period. Thank you.
Thank you. Shannon, I think you're next in the queue.
Sorry, having problems with the mute button.
No problem.
Thank you, Mr. Chair. I'm reporting today on the outbreaks that happened during this reporting period. Lee Manor and Grey Gables both experienced outbreaks. The COVID outbreak at Grey Gables was reported on the last report, as it had started on February the 5th. This outbreak was declared over on February the 19th and had affected 6 residents. Lee Manor experienced 2 respiratory outbreaks, one on 2 North that started February 26th and went to March 16th, with 12 residents and 3 staff affected. Another was on 2 South from March 29th to April 11th, with 9 residents and 1 staff affected. On April the 12th, Lee Manor went into a confirmed COVID-19 outbreak on 2 North that affected 6 residents and 4 staff and was declared over on April the 29th. The outbreaks have been well managed and the spread has been contained. I also wanted to make you aware that when a home is in an outbreak, all admissions and transfers are suspended for the whole home until they are cleared by public health. The challenge with the outbreaks being so sporadic has been the trying to fill the beds in between outbreaks that affect our occupancy data as well. Thank you.
Thank you, Shannon. And Karen, you have the floor now.
Thank you, Mr. Chair. Good morning, everybody. I just wanted to highlight our continuing efforts to recruit for several positions within the care communities. Interviews and reference checks continue to be a joint effort between staff at the care community and our fellow team members in the HR department. We see an increasing number of applicants who come to the interview, but then maybe don't provide their references or don't wish to proceed with their education to get the position, or they only want a full-time line. So that's kind of frustrating after you go to the effort of getting to interview them, but I think it's a sign of the times. As you can see by the chart there in the report, sometimes we're barely replacing team members who have left, which is very unfortunate. So recruitment continues to be very much an uphill battle. I'd also like to highlight a Color It story for you today from Lee Manor, where they have recently reunited former roommates. First of all, it's to have a resident return to the community once they've been admitted to a care community is a true Color It story. So that was a success in itself. And then to have them want to come back to the care community where they experienced care previously says a lot about the care either this resident received or observed from his first stay. It was an entire team effort to reunite this gentleman with his original roommate to enable their friendship to continue. So a true Color It success. Thank you.
Thank you. That's a very nice story, Karen. All right, we'll take questions from committee members. I'm not seeing any questions. I just wanted to share with the committee, I had the opportunity to visit a family friend at Grey Gables about a week and a half ago, and my wife attended with me. And when we were sitting there, first of all, the place was spotless. There was staff cleaning everywhere. We were sitting there waiting for our 15 minutes after we had taken our rapid test, and it was just the feeling you got was everyone was so friendly and so engaged with the clients. So it just felt like a wonderful spot to be. In meeting with the elderly gentleman, he'd only been there a couple of weeks. The staff were well engaged with him. He was having a lot of fun with them, and I think they were having fun with him also. But he just reported on what a wonderful spot it was to be, and he'd never, this was his first time in after a stint in the hospital, and I think he's 90, 95 or 96, but cognitively everything is still well intact, and just wanted to pass on to everyone at Grey Gables and to the committee members just how warm and friendly we felt being in the setting. So anyways, congratulations. And I'm sure I'm gonna have the opportunity. I understand my aunt's going into to Rockwood in the next 2 or 3 days, so I'm gonna have the opportunity to go visit her too. But I certainly passed along to our family members when they were making the decision about how well I felt about what we were doing as Grey County as far as long-term care went. So that entered into their decision making. So anyways, thanks again. We now have the COVID update. It's LTCR.
Mr. Chair?
Yes.
Sorry, we do need to vote on the motion.
Oh, sorry, Heather. Thank you.
Okay.
All in favor of receiving the operational report? That is carried. Thank you. We now have LTCR CM 08-2022 regarding the long-term care COVID-19 status update. Be received for information. Can I have a mover, please? Moved by Member Woodbury and seconded by Member Klumpus. Are you taking us through this, Jen?
I am. Thank you, Mr. Chair.
Okay.
Just going to move my notes over so that I can see them. Okay. So I'm going to just kind of highlight some of the information in the COVID update. It seems like a long time has passed since this report was finalized. So I'll just add a couple of verbal updates. So over the past number of months, we continue to see the easing of restrictions implemented throughout the province, and the shifting of pandemic response being a provincial directive to operators having their own policies and implementing their strategies at that level without the overall kind of directive from the province. The new variants we continue to see COVID infections across long-term care homes as well as in our local area. So there have been some updated directives that are highlighted in the report. Under vaccination, we continue our efforts to offer third dose to designated care partners and team members as they become eligible. Everyone is up to date at this point, as long as and then as they become eligible, they get their third dose. We also are offering fourth doses for the eligibility of team members who are over 60 or have immune compromised issues. And so we continue to offer that for designated care partners and team members. So that continues to be a focus. Under surveillance testing, two kind of significant things I wanted to note. The Ontario Science Table sent out a brief updating the sensitivity of how to test for Omicron using an oral nasal method. So we have implemented that in our self-testing sites as an option at each of the homes. And then I just wanted to also highlight that in the 3 long-term care homes, we continue to do every visit, every shift, rapid antigen testing, which is above the requirement as per the ministry. Having said that, I wanted to just note anecdotally, we are screening 1 to 3 positive rapid tests a week at each of the sites. So it is an effective screening strategy, and we're going to continue doing the every shift, every visit rapid testing for the foreseeable future. It is catching positive cases and preventing people from being in the home who have COVID. So it's positive to know that that's working. There were some changes around increasing the opportunities for unvaccinated general visitors and residents and families, residents that want to go out for overnight absences. Those changes were made in early April. Staffing, as Karen mentioned, we continue to be focused on recruitment generally, and the update just highlights some collaborative partnerships that are ongoing with the YMCA Employment Services and the Grey Bruce Ontario Health Team and the LIN to create an emergency response team that now has over 30 individuals who are ready to be deployed if needed. And we were able to access emergency relief staff to support Lee Manor in a staffing crisis, and that went very well. So that project has been a success, I think. And as we move out of, hopefully, crisis, those individuals have some training and experience now that will maybe lead them into a career in long-term care. So I think it was a worthwhile effort. In March, and this is something we've talked about a number of times over the past number of meetings, is recovery and wellness. And in March, we focused on promoting staff wellness. The month started with staff receiving a letter of appreciation from Grey County's warden and CAO. The week of March 21st, self-care wellness packages were delivered to each home for all staff to jumpstart their own self-care. And all 3 homes also released a wellness newsletter at the end of March. And the wellness newsletter will be a quarterly publication that features wellness tips, resources, Color It Spirit photos, along with Color It stories. And that newsletter was really well received. There have been a number of updates related to funding. The Ministry of Health announced a lump sum payment of up to $5,000 to eligible full-time nurses and prorated payment of up to $5,000 for eligible part-time and casual nursing staff across the province. The eligibility is outlined here, and we are well on our way to coordinating that and rolling out those payments. End of March, the new legislation included making the PSW wage enhancement permanent and also making it easier and quicker for foreign credentialed healthcare workers to begin practicing in Ontario. There was an update on winding down the co-payment waiver. And on April 8th, the ministry announced an extension of the occupancy funding protection until September 30th, 2022. And that was really welcome news. As Shannon mentioned in the operation report, occupancy has been a little bit of a challenge with having outbreaks. I just also wanted to add, since this report was finalized, we also received notification from the province of COVID containment and PPE funding for each of the homes for the period of April, May, and June. So that's also welcome news. Our partnerships continue. I did have the opportunity, I was invited to present to the Thornbury Clarksburg Rotary Club to provide an overview of long-term care and our Color It Your Way philosophy and our lessons learned. We continue to be in partnership with our local long-term care committee and other healthcare partners, and are, as always, thankful for the support from council, CAO, and senior management team and other departments. And that is the COVID summary. If there's any questions.
Thank you, Jennifer. Any questions from committee members?
See Councillor Robinson.
Morning, Christine. Go ahead.
Good morning, Mr. Chair and committee members and staff. Thank you very much. It's been a most informative morning. Jennifer, I want to say congratulations. You're now on the lecture series. I think that's pretty awesome to get on there. I wondered, it's just a general question. With all the policy changes, procedural enhancements, could you just provide, I guess, an update on how attainable those policies are for staff to reference them? Do they receive a copy? It's just a general question. I was curious. Thank you.
Sure, thank you. Through you, Mr. Chair. Yes, and when we go on to the next update around the legislative changes, there is a large volume of policy updates and changes. So we have, our policies are available to all staff in a couple of different ways. They are available online, and there's also a hard copy, paper copy available in each of the sites, and they're in an accessible place. The teams will have slightly different approaches to how to engage team members on changes that are specific to them and their department. And it'll range from team meetings, posting the policy. They get uploaded to our Surge Learning platform. So if it's something that impacts, we can also assign the updated policies to a small group or all staff, and people log into our e-learning platform and are able to review it and ask questions and then sign off that they reviewed it. So there's a number of different ways. The communication can be one of the toughest parts of a large operation that's 24/7. So we try to tell people, what's the saying? Five times, 5 different ways to make sure that people have lots of opportunity to get that information.
Thank you, Mr. Chair.
Any other questions from committee members? Jennifer, you touched on recruitment, and I think Karen did also. I just had a question in regards to, I think we have, 450 or 500 staff altogether. Do we have, what's the projection for the next few years as far as retirements? I know all of our executive directors and senior managers are very young, but I'm just wondering overall, what are how many retirements we're expecting?
Thank you, Mr. Chair. That's a good question. Kim, I don't know. Yeah, you're on mute.
Yeah, I can comment. One of the challenges that we face around having an accurate forecast of that is that people have, and they're absolutely within their own control, and then based on their own personal circumstances when they make a decision that they want to when they want to take their retirement. Some people decide to stay much longer than what their unreduced date is, and some people choose to go earlier than that. I think it's certainly within our abilities to run at least a projection that would give you a sense of where things are. Certainly, I just because I see the letters, my sense of it would be that we have in the last 2 years seen a bit of an uptick in retirements, but part of that was maybe COVID, and part of that is just the fact that that's where we are, where staff are in their timelines. But if it's something that's useful to the committee, and I'm sure the senior team as well, we can run that report and just kind of see where things lie.
Kim, thank you for that. Certainly, I don't want to put anybody through any extra work. It was just a general question, wanting to know, roughly where, how many people we had. But no, I mean, if it's not a huge concern for the leadership group, then I'm certainly fine with that. Anything else before we go on to the next one? I'm just scrolling here and not seeing any. So all in favor of the report? That is carried. Thank you. We now have the LTCRC M10-22 regarding the Fixing Long-Term Care Act for 2021 and the Regulation 246-22 update be received for information. Can I have a mover for that? Moved by Member Burley and seconded by Member O'Leary. Jennifer, who is taking this one? You are again?
I am, thank
The
you.
floor is yours.
And I'm just going to share my screen. Okay. Are you seeing?
That looks good,
Yeah.
Jennifer.
Okay, great. Thank you. Okay, thank you, Mr. Chair. And this is an update on the Fixing Long-Term Care Act and Regulations. I prefer to just call it the Act and Regulations and focus on transforming for positive as opposed to fixing. So the first number of slides are an overview. So the Fixing Long-Term Care Act came into force on April 11th. The previous act has now been replaced and will no longer be in force. The Act and regulations have been updated to provide a framework to ensure every resident experiences the best quality of life, supported by safe and high-quality care. The new Act and regs lays the groundwork for systemic, long-lasting reform over time that will enhance quality care in several key areas. The priorities are bundled into three broad areas: staffing and care, accountability, enforcement, and transparency, and building modern, safe, and comfortable homes for seniors. The new legislation, just wanted to highlight the important changes. There's enhancement to the language in the Resident Bill of Rights, focused on, one of the main areas is around supporting caregivers and including caregivers in the Resident Bill of Rights, streamlining long-term care development and redevelopment, a greater emphasis on resident quality of care, implementation of new enforcement and compliance tools, and a commitment to provide a system targeted average of 4 hours of direct resident care per day by March 2025. There's focus on ensuring accountability, so setting criteria and amounts around penalties, expanding the whistleblower protection, enhancing screening measures, and improving resident safety, well-being, and quality of life. So some focus on infection prevention and control and interdisciplinary assessments for residents' palliative care needs. Further improvements around resident experience, specifically around air conditioning and menu planning, enhanced emergency planning, and as mentioned, the definition of caregiver. Clarifying staffing requirements and specifically medical directors, and so a little bit more information around calculating direct care targets. So with specifically around the Resident Bill of Rights, the new the areas that I just wanted to focus and highlight here is around providing residents with the right to ongoing and safe support from their caregivers. And the pandemic highlighted the challenges around visitor restrictions and operators not having visiting policies. And so this looks to close those gaps. 4 hours of direct care. The new act sets out legislation for the provincial targets and specifically around direct care, which is RNs, RPNs, and PSWs. And then additionally set out some targets for allied professional healthcare, which is roles like physiotherapist, social worker, dietitian. Under emergency planning, the pandemic highlighted gaps in the previous legislation around emergency planning. The new language looks to cover those gaps, to close those gaps. We are well on our way to meeting this language. I am fortunate to have been invited to be part of a small working group with the Ministry of Long-Term Care and some other operators to help create a resource guide to assist operators in meeting the July target for updating our emergency planning policies. Around palliative care, the palliative care approach aligns well with our resident-centered Color It Your Way philosophy. This is really a broader approach than just end-of-life care. It's really linking with resident-informed care that begins the moment they move in and includes the end of life, but it's broader than just that end of life. We have recently purchased clinical decision-making tools, which supports us in palliative care assessments and care planning. Our association, Advantage Ontario, has recently run a series on palliative care approach as an education series, and we have had leaders and team members participating in that. And so we're well on our way to making that transition. Around quality, our 3 homes have well-established quality improvement frameworks and program. The new language requires a formal interim report to be published on our website and provided to resident and family council. Also requires resident and family members as members of the quality team. And so we'll be making those changes and ensuring that an interim report is posted. The new compliance and enforcement tools, these are updated enforcement tools to hold operators accountable to the new act and regulations. And specifically, there's some are carried over from the previous act and some are very new. So remedied non-compliance. This is a welcome change. Inspectors may address very low risk instances of non-compliance during an inspection without having to take further compliance action. So often, we've brought a report about an inspection and said these were the findings. They were all resolved before the inspector left the home, but they still had to show up on the report. Now they won't need to show up on the report. They'll be able to be dealt with while the inspector's on site. Compliance orders. When there is a non-compliance finding, the inspector may issue an order that requires the home to do something or to refrain from doing something in order to achieve compliance. So they can do that on site while they're there. The administrative penalties, the next slide talks a little bit more about that, as well as increased fines for offenses. So here's some information about the administrative monetary penalties, and so it outlines what they are and how they might be applied. They also do reference an appeal process. Complaints. We have already completed the required changes, which is important because they were in force April 11th under the complaints. We updated the policy and our posters, as well as our website, to include the Ministry of Long-Term Care number and the contact information for the patient ombudsman. The language in this section clarifies the need for immediate reporting of any complaint that alleges harm or risk of harm to one or more resident. And we were already reporting any complaints of that nature, so it's not a significant change for us. Whistleblowing, again, we have really fulsome policy around whistleblowing protection, and the previous language in the Act did cover this. What they've added, though, is specifically around resident protection for members of residence council and family councils specifically. So that's the change there. Menu planning, we are actively working on this. and our corporate dietitian is providing some support and leadership. And the significant changes here are really the ministry's efforts to enhance choice for residents. So choice on what their meal choices are, the number of choices available, the choice around meal time. In the previous act, there were specific times listed, and this allows a little bit more flexibility to support residents being able to direct when their meal times will be. There's 3 slides dedicated to infection prevention and control, and it's not surprising that this is a significant focus of the Act and the regulations, with considering the trauma and challenges that happened in long-term care over the 2 years of the pandemic. So the summary of changes is, really more comprehensive requirements around training and education, a required quality management program for infection prevention and control, a requirement for an ethical framework to guide decision-making related to infection prevention and control. And legislation and regulations also make reference to a new evidence-based standard, which will be issued under the Act. So the regulation sets out a requirement for infection prevention and control leads to oversee this significant program. And it's an increased number of hours than we currently have. And so we're actively working on a process to increase the number of hours of our IPAC leads, and also to make sure that they have the education and training that's required. It is a significant undertaking to be certified as required, and it's not easy to access that training either. So this is one that the requirement is it needs to be in effect now, and individual leads have 3 years to be certified, and the certification is available at a small number of universities, and it is a significant undertaking. So we're working at it. I do have some concerns around how realistic it is to find 650 plus, as required across the province, individuals who are willing and skilled to take on the role as it's outlined. That's just a little bit more information. So screening measures. This is, we're used to talking about screening in terms of at the front door and COVID screening. This is really about screening in terms of recruitment for like vulnerable sector police checks, etc. And the biggest change here is introduced enhanced screening requirements for members of boards or committee of management. And I can let the committee know that the ministry was contacted for some direction on how to meet this legislative requirement with current elected officials in the time frame. And so the ministry response was that it is not applicable to current committee of management members, but that it will be applicable to new councillors and committee following the election. So that gives a little bit of time for us to build those systems into place. Dena gave an update on the medical directors, and the significant change here is around the requirement for medical directors to complete the course that is offered through the Ontario Long-Term Care Clinicians, and also highlights and formally acknowledges the importance of the role of medical director in long-term care. And we are very fortunate to have 3 very committed and skilled and knowledgeable medical directors supporting our homes. The visitor policy changes, Grey County long-term care, we were definitely leaders in this area around visiting and formal recognition of caregivers. And much of the language in the Act is already reflected in our policy and our program. And so there's very little change to be made. And in fact, we're often invited to speak about our experience and our policies and our program that we have in place to help support other long-term care homes across the province. So I am very proud of the work that our leaders and our homes have done to support residents and their family members or friends who they designate as an essential caregiver. And that's just a little bit more information. I also think it's really positive that the definition of caregiver is built into the Resident Bill of Rights. So I think that's a really positive direction that the province is taking that language. Around air conditioning, the timeline for this is June 22nd. This is to ensure that air conditioning is installed in residents' rooms, to ensure that new home builds have sufficient time to meet the requirement. So the operators have 6 months to implement this. We have met recently with our maintenance leaders and are feeling confident that we meet the requirements in the legislation. The updates to the language around development and redevelopment is really a focus on the removal of red tape and administrative burden to facilitate the goals that the current government has in terms of rebuilds and development. The transition periods, I didn't note them on every slide out loud, but they're noted on every slide. The dates that the new language and regs come into force, and they really range from April 11th to 3 months is the most common, and then there's a couple that give operators 3 years to implement. And so next steps, we are currently already in the process of updating policies and procedures to make sure that it reflects the language and the requirements of the regulations. While we're doing that, we're also looking to make sure that our policies speak to our Color It Your Way resident-led language as well. We're preparing education resources to team members, including the slide deck will be a useful tool to give an overview to all staff. Medical directors have already been updated and are working on their piece. Health Quality Ontario is the overseer of our quality improvement plans, and those will be submitted on June 30th and will help support that interim report that is required. And for all of 22, we've been looking at working on our back to fundamentals. So working with department leaders and teams on quality improvement activities and operational planning overall. And I'm going to stop sharing and just make one more comment. The one risk of the new regs and the legislation and the chart with all the deadlines is there's 2 risks. One, can we achieve it all? And I'm not sure that it's realistic that we can achieve all the deadlines. We've created a chart with all of the requirements sorted by deadline and then also sorted by risk level. And so we're going to start with the riskiest, the things that worry us the most, and then work our way through. Our intention is to meet the deadlines, but I just wanted to make sure committee is aware that it may not be realistic for all of the areas. And then the other risk that comes with new legislation and acts that have all these deadlines and all these checklists is that we put our heads down and we start worrying more about the checklist and the deadline and not enough about the resident experience. And so coupled with the overview, we're actively talking with each other, with the leaders, with the teams about our promise is to provide resident-led, color it your way care. And that's our commitment. That's where we are accountable. And when we are doing that, we will meet the regulations and the act. And so the senior leader team, we can be working behind the scenes on the checklists and the deadlines and the policies and the paperwork. But there is no need to shift from that focus for every team member at the homes. The focus is always about the resident experience, and we'll be okay. So I just wanted to highlight that, and thank you. I know it's a lot of information. Happy to take any questions or hear any comments.
Thank you very much, Jennifer. Is there any questions or comments from committee members?
Councillor Councillor O'Leary.
Brian, go ahead. The floor is yours.
Thank you, Mr. Chair. Jennifer, you just kind of touched on it at the end there, but my first thought is how much of this is actually welcome change or positive change, and how much of it is just increasing stress on staff? Because more stress on staff does not translate into a happy place to work and good care.
Yeah, thank you. Through you, Mr. Chair. Totally agree. I know that changes needed to be made. I'll keep saying it over and over again. I wish it wasn't called the Fixing Long-Term Care Act, more the Transforming, because there's already a strong foundation of dedicated, caring people that operate and run, work in our long-term care homes. So I think that it would be easy to have it be a very stressful, transition period if we're not intentionally working to make it not that way. We have a good foundation. Much of this is already in the policies. It's already part of the work that we do. So some of it is just updating the policy, it's formalizing the language. It doesn't have to be stressful and cause a lot of extra worry. If we're looking after the residents, if we're caring in every moment about the resident experience, we're going to meet the mark. And I also have felt very supported by committee that if we have an inspection and we get a finding around a piece of paper or a document and we fix it, that's okay, because ultimately the resident experience is what matters. If we miss a dotted I or a cross T, we need to make that better and we can fix it. But it's not something that we need to be kind of losing sleep over. We need to be making sure the resident experience is the number one. So I think it's a risk, Councillor O'Leary, but we are intentionally talking about it to try to minimize the stress that it causes.
So just in terms of support, as far as council's concerned, you don't think that we should be pushing back then at this point? We should try it for a bit? Or I just think, you should at least know that the support's there from us, that if we do need to push back, we should be acting probably sooner than later. Because I worry about the stress level of staff. Yeah. They've already been through enough as it is.
Thank you for that. And I think what we'll do is, what I'd like to suggest is that we know that, take that information back, and as we're doing our assessment, if there's a couple of areas that we feel are really unrealistic in terms of the time frame. So 2 areas that worry me a little bit are the IPAC lead certification and recruitment, and the changes to the emergency planning. There's a lot of paperwork around the emergency planning that needs to be updated, and the timeline is very tight. We can bring that information back to committee with a little more detail around whether or not we feel they're achievable requirements or not with the time frame. Would that work for committee?
Mm-hmm.
Okay.
Great, thank you.
Thank you.
Yeah, certainly bring that back, Jennifer. You have a number, or all the members here are fully supportive of the work that's being done in our long-term care sector. So any way that we can support you, we'd be more than happy to try. I think I saw Christine's hand. Go ahead, Member Robinson.
Thank you, Mr. Chair. And really just to dovetail on what Councillor O'Leary was saying, I think it fits in quite nicely. I was wondering, as we're thinking ahead to possible delegations, minister delegations at AMO, if there's anything that may fit in for potential delegation with regard to the new changes and the transforming to positive, that certainly let us know, and then that could be something for consideration, ultimately a council for a possible delegation.
Thank you.
Any other questions? Councillor Burley, go ahead.
Thank you, Mr. Chair. I feel it's an amazing report, and I think it's high time that the act was changed to what they're doing today. I really feel there's so many horror stories you've heard throughout the long-term care business, say in the GTA area and so on. I'll use that for an example. Would reflect on all long-term care homes, but Grey County's long-term care operation is way ahead of the field. We're way ahead of the pack because of our great staff that we have in place. And I'm quite sure that all generating your staff will be able to cope with the changes and the pressures and so on. I don't envy your job. I commend you for doing it and all your administrators, and can't say any more than that. Thank you.
No, I think you're absolutely right, Dwight. I mean, sometimes when the government has to enact legislation, they paint everybody with the same brush. But I think we're, as Jennifer mentioned, we're a long way towards achieving most of the recommendations that are in this legislation. Jen, I had a question just in regards, we've talked about recruitment a little bit, but in order to get to the 4 hours a day, will our, what's the new staff, is there a care support assistants, will they be included in that number to get to the 4 hours? And do we have any idea on how many additional staff will need to recruit across the organization to get to the 4 hours? Thanks.
Thank you, Mr. Chair. So I believe that the CSA's time is being included. I'm looking at you, Karen. I feel like I read that somewhere, that it is being allowed by the ministry. In our count, though, we are not counting the CSAs. Our approach to the CSA role is to support and fill the gaps that we have as we recruit personal support workers. So our hope is that we can recruit CSAs. They get a taste for long-term care and they discover they have a calling for it. And then we support them to pursue a career as either a PSW or an RPN or a recreation team member or a food service worker. So we're not counting them in our count. I can share that for 2022, we are between 3.25 and 3.3 hours of direct resident care across the 3 homes. And so we're well on our way to achieving that goal. Our plan would be for the 23 budget to do the bump to the next kind of level. And I just can't recall what that is, whether it was 3.45, I think, in 2023. In terms of, to make that change, so to give you an example, Lee Manor in 2021 was at 2.8, and in 2022 is at 3.25, and it was about a similar jump for each of the homes. That was an increase in 58 positions is what it came down to across the 3 homes in our budget report. Mary Lou, I think that's the number that we that we ended with. So it is a significant number of people, and it will be another jump into 2023. I can find out. I just don't have offhand exactly what the number of recruitment would be. We are working with our partners in human resources. We have our human resource business partners that are supporting us in having a recruitment and retention plan and strategy over the next number of years to be able to meet those requirements.
Oh, thank you, Jen. Just one follow-up question. The additional recruitment that's required, will it be fully funded by the province, these additional hours?
So it's a little bit uncertain, but yes. So the provincial average of 4 hours of care across the province is being funded. How that trickles down to each individual long-term care home and operator, it's still a little unclear. So we continue to work with our association and our partners in finance to sort that out, to be sure that we're being funded appropriately for the levels of care that we're providing. And
Yeah,
that may, through you, Mr. Chair, to Councillor Robinson, that may be something that we would be looking to include in a delegation at AMO.
All right, any other questions from committee members? Not seeing any. Call the question. All in favor of receiving this report? And that is carried. All right, I think that takes us to the end of our meeting. Our next meeting date is scheduled for July 12th at 9:30. If one last chance, is there anything else from members of committee or from our senior staff? All right, nice seeing everyone again, and I hope you enjoy the nice warm weather that we're going to be receiving this week. We stand adjourned.
Oh, sorry, Mr. Chair, we do need a motion to adjourn.
I think I saw
Sorry,
Councillor Burley.
I thought the chair was able to. I've got a motion by member O'Leary and seconded by member Burley. All in favor? And that is carried. Thank you. Take care, everyone.